going to have you take your hand and just
Okay, got it.
loosen the whole pec major, and even if you want to get the pec minor in there, you could. If it's
Oh,
tight.
yeah.
It is, okay, so here you go.
Yeah.
Just let this arm dangle.
Oh, there we go.
I heard your
I heard
something
that,
click.
yeah.
Is that your shoulder or your
Yeah,
wrist?
it was my shoulder.
Okay. Dr. Dave here with Synergy Wellness in New York City with Dr. Ginny.
I'm not a doctor.
Well, she's a physical therapist, close enough. Some physical therapists are doctors. She's been doing physical therapy for how many years now?
Oh, about 31 years, yeah.
So before they even had a doctor.
That's right.
Okay. So you're grandfathered in, so to speak. Okay?
Yeah.
Yeah. So she's. Why don't you tell us a little bit about what brings you in?
Well, I have chronic L5 and right SI issues. I have a spondylolisthesis. That's like a little instability in my spine. And sometimes, if I don't take care of it, it goes up into my neck and it affects my shoulder. But I come in regularly and Dr. Kulla takes good care of me.
Yeah, so we're going to take a look at her SI joint on the right side. We're going to do a little ART, adjusting of the right SI joint. You said before that you had a little bit of foot ankle problems.
So yeah, I just brought this up today actually, that my left foot, I had fractured my fibula. And ever since then I've had, foot issues, which I've dealt with myself. But at the same time, I get into points where everything just spasms so badly. I have to stop in the middle of the street, take my shoe off, manipulate it, or get it to go a little bit better.
Okay.
So it's time that I address this chronic problem.
So with your foot, let's start with that. Let's have you lay on your back. Where do you get the spasms?
I do have an neuroma here, but that's not active.
Okay.
I get the spasms like here and here.
Which is where your neuroma is.
So what I do when it's bad, what I do is I pull on it.
Okay.
And then that will relieve the problem, but then that's just relieving the problem. So
okay, so
I
you're
have
adjusting your toes.
Yeah, I have fractured here in the fibula area.
Okay.
And I believe I have some atrophy here. So I probably got a little bit of nerve damage because I see some wasting here over the years.
Yeah.
So there's some imbalance going on there.
Okay, let's go ahead and take a look. Why don't you go ahead and lay back?
Okay, back this way.
Mm-hmm. Okay, good dorsiflexion. So I'm gonna pull the foot up this way. Okay.
Sure.
I want you to resist me. Ready? 1, 2, 3. Resist. Good. And now I'm gonna bring the foot up. Relax. Just relax here. And I'm gonna pull down. I want you to resist me. Okay. 1, 2, 3. Resist. Good. Then we're gonna pull the foot up and out. And you're gonna resist me. I'm gonna pull down. 1, 2, 3. Resist. Good. And straight away. 1, 2, 3. Resist. Good. 1, 2, 3. Pull it all the way up. Toes. Yep. 1, 2, 3. Resist. Good. Out. You're gonna pull it out that way. And 1, 2, 3. Resist. Good. Now bring your toes up towards you, and 1, 2, 3, resist. Good. Okay. So when you adjust your toes, your neuroma feels better?
I guess, because what happens is it starts to burn. So I'm assuming it's affecting my neuroma. It starts to burn, it starts to get numb. The toes start to get numb. So it gets to a point where I can't tolerate, and I just have to pull on it. And that relieves it for a little while.
If you don't do that, what happens?
I actually was riding my bike home the other day, and it happened. I didn't want to get off my bike, and it just got so bad that when I finally got home and did it, I had about 20 minutes of symptoms of the burning and tingling and numbness.
Okay, and right in this area.
Yeah.
Okay.
So I've been injected for a neuroma there twice already.
When was your last injection?
Oh, probably over a year ago. That's the only time it bothers me. If I'm on barefoot or not cushioned shoes for too long.
Did you have cushioned shoes on before? Just relax here.
Okay, yeah. Or if I'm in wedges, which I don't really wear that often. The ones that I have now are actually very cushioned. That's why I have them.
What about when you were on your bike? Did you have cushioned shoes on?
Nah, just my sneakers. I usually do okay on my bike actually.
Okay.
Because I have cages. I don't have clip-ons.
Were you on your feet all day that day earlier before you got on your bike?
Yeah. I'm on my feet all day.
So just
It feels good.
Yeah, just checking the tarsals here.
It feels like that the spot, like, you know, my husband massages it, it's like the spot that gives me the most.
Right in here.
Yeah, yep, you got it.
And that's the cuneiform.
Yes.
So we're actually going to do a talus and cuneiform adjustment here.
Yes,
so
thank you.
I'll just relax here.
Mhm. Oh, not bad.
Okay, that's dorsiflexing a little better. It was slightly off. It really wasn't bad, but now I'm going to have you bend your knee. I don't know if you guys have these in PT, a speeder board.
No, what is
So
that?
you can adjust the tension.
Nice.
And you're able to adjust any kind of other, extremity joint, like for example your elbow or your wrist if you needed to, or hand or finger. It just helps.
Springable.
It's springable. It's a little bit of more of a lighter force adjustment.
Okay. I'm glad I asked.
Yeah.
Just, that happened the other day with my foot when I was coming home on the bike, like, I gotta get this rest.
Yeah, a lot of people think, they come to the chiropractic, back and neck and nerve issues, but a lot of times people forget about shoulders and again, not all chiropractors correct those things.
Right, exactly.
You used to have, if I remember correctly in your notes, left shoulder issues.
Yes.
What's going on with your left shoulder?
It's about 80% better. It's still there a little bit.
What kind of problems are you having there?
What do I have? So, and if I do this, sometimes it'll get a little adjustment. It'll feel a little bit better. But again, it's like my toes. It's not solving the entire problem.
Okay.
So I'm a little restricted with, like right there, I start getting pinching in there.
Over the AC joint?
The AC joint.
Okay. Can I do a...
I could do that, which I couldn't do before.
Okay. All right, so let's do just a quick shoulder girdle assessment.
Sure,
okay?
absolutely.
Your foot may be a little bit sore.
That's fine.
But shouldn't be too bad.
That means we need change.
Yeah. Let me know if it continues, of
Yeah.
course. But arms out like this. We're going to lower it just a little bit.
Okay.
I'm going to push down. I'm going to check the humerus and the anterior deltoid. 1, 2, 3, resist.
Is the
That
apparatus a little
hurt.
bit?
That hurt there.
Yeah.
So you definitely have an anterior humerus on that side, which is very common, as you know.
Right.
Much more than a posterior. So we'll correct that, and what we'll do is we'll just challenge it right now, just to make sure that's the right correction. And 1, 2, 3, resist. Better. Yeah. So we just neurologically challenged it, but we're going to adjust that. Okay. So now let's take your good side. And we're going to check just the pec major and sternoclavicular joint.
Okay.
And 1, 2, 3, resist. Good. Any pain?
No.
Okay, and 1, 2, 3, resist. Any pain?
No.
Okay, and the bad
I feel like I
side.
need to work out.
I think we all do. All of us, me included. And 1, 2, 3, resist. Little weak. Was that painful?
Not really. It was just harder to hold. Just weaker. Yeah.
Okay, you winced a little bit, and we're gonna try one more here. 1, 2, 3, resist.
No, so Lindsay was trying to overcome.
Okay, both of those were weak, but they were not painful, correct?
Teeny bit, like maybe 1 out of 10. Yeah.
Okay, so we're gonna correct that. We're gonna loosen up the pec muscle, and being a physical therapist, you know this. So what's happening now is your pec muscle is tight, and it could be pulling this humerus anterior, but your sternoclavicular joint right here looks like it's out too. We're gonna check visually in a second, but I'm gonna have you take your hand and just
Okay, got it.
loosen the whole pec major, and even if you want to get the pec minor there, you could if it's tight.
Yeah.
It is. Okay, so here you go.
Yeah.
Just let this arm dangle.
Oh, there we go.
I heard your
I heard
something
that,
click.
yeah.
Was that your shoulder or your
Yeah,
wrist?
it was my shoulder.
Okay. So you guys probably didn't pick up on this, but she was just loosening it. She just relaxed her arm, and you could feel her shoulder kind of go clunk right back. Probably in place because she's got her finger right on the anterior part of the joint.
It was a good feeling, yeah.
So I may not have to adjust the anterior humerus now.
Okay.
We'll just double check before I go and
Yeah, it's definitely
start
when I have
adjusting.
pec minor. I really loosened it up. Yeah.
All right, so now we're going to check check that part again. So 1, 2, 3, resist.
So much better.
Much
Oh,
stronger,
yeah.
much stronger. And I've even pulled a little bit
Yeah.
harder on
Yeah.
that one.
And no
Now we're
one's-
going to check the sternoclavicular branch and 1, 2, 3, resist. And that's weak still.
Still weak, yeah.
So that tells me most likely that's out. So I'm going to have you stand up on this side, face the camera, face us. And sure enough, look at that. Zoom in. See that? See how my right thumb, my arm with the black wristband on, see how that's higher? You know, it's only a few millimeters, but it's enough to create that other 20% that she hasn't healed, right? So she's never going to heal that 20% unless that's corrected. So let's go ahead and do that. It's a lot of fun. Lay on your back. I'm kidding. It's not painful. It's not painful at all. It can be painful, but I do it gently the first few times with a drop table, so it's really painless, and usually it holds. If not, then we have to get in there a little bit more manually. But slide up a little bit, a little more. My hand. There we go. Okay, so remember, her clavicle on the left side was higher, and in order for it to go higher, typically it has to go medial and anterior as well. Okay, so I'm gonna have you, go ahead and turn your head to that side. Okay.
Not bad.
And one more here. That was a little too light. Let's do one more here. Okay. Now we're going to test the sternoclavicular joint again. And 1, 2, 3, resist.
Better.
A little weak, but
better. Yeah. Just a little bit there.
Hold off on that for now.
Okay.
But let's check it right now. Let's just check the alignment. And there we go. It's balanced. Okay, now we didn't check before, but you had said that you had an issue when you put your hand above your head.
Yeah,
you should be able to do that now with less pressure.
There's more range. Yeah. The intensity is much less right there. It's not pinching. It's just more like an awareness now. That feels a little different.
Being that you're
more range though, definitely more range. Yeah.
Great. Being that you're a physical therapist and you're working with your shoulders and arms all day, we'll check it next Saturday.
Okay.
Make sure it's in alignment. In a worst case scenario, you just go to your office and have one of your PTs tape it. But let's wait a few weeks. If we have to do that, we'll just tape it down for 4 to 6 weeks. The Sharpies of fiber will start to heal and bind and repair, and then you won't have any issues after that. Okay.
Sounds great.
All right. So let's check your right SI joint.
My belly.
On your belly.
I have a belt on. Is that going to bother you?
No, you should be fine. So right leg here is a little bit shorter. That tells me her pelvis is pulled back on this right side, which is her pattern typically. Okay.
Is that most people's pattern?
No, but people typically have patterns, meaning if it's the left hip that pulls back and down, I often find that's their regular pattern because the brain's neuroplasticity, right, builds memory, muscle memory.
Sure.
So I find most of the time it's a pattern unless they had a slip, a fall, or some sort of injury that was a little different. Okay, let's start with your right SI joint up first. So we're going to do a little bit of ART here. So I'm going to go ahead and brace yourself right there so you don't fall over.
Sure.
Okay, go ahead. And you're going to kick this leg this way. And then you're going to bring it back against my thigh.
Okay.
Okay, go ahead. Good.
you want knee flexion or it doesn't matter?
A little bit of flexion, just like you're, you know, about 15-20 degrees is good. This helps to loosen the glutes up, which cross over the SI joint.
Oh yeah, I feel that. Not bad.
Yeah,
You're on,
like
you're on the right spot.
Yeah,
Definitely.
okay. And down a little bit.
Oh,
Yeah,
sure.
there we
Sorry.
go. Yeah, there we go. That's another spot right there.
Mm-hmm.
Okay. Take a breather. It's tough, right? It's the most exercise you've gotten in a couple of months.
We need a gym.
Right. Okay, go ahead. Just a couple more. Okay, and relax. Straighten this bottom leg.
Oh, it's kind of just made my shoulder.
Yeah. Okay, we're gonna have to check that shoulder because we've felt that twice.
Yeah.
So there's clearly some instability in there.
Yeah.
I didn't pull that too
No,
hard, you know. I
not
just
at all.
gently pulled. So
But that's my body too, doesn't it?
take a deep breath in. And blow out. Good. And the other side up. Okay. And take a deep breath in again. Good. And lay on your stomach. So she actually had L4 and L5 were shifted to the left. That corrected with the SI joint adjustment. Sometimes we have to do two separate adjustments there. A little sensitivity.
Yeah, I feel
there.
that. Uh-huh.
Okay, keep your legs straight. Raise one leg as high as you can. The other one. All right. Turn over on your back. And cross your arms in front of you. Good, almost. Just like this. There we go.
That was good, Ron.
Tuck your chin down. Deep breath in. Come on up. Again, we'll check that shoulder here again in a second. So the neck's been feeling really good, but I'm feeling just a few minor subluxations right there. Feel that?
Mm-hmm.
There. So we're just going to correct those before they become symptomatic. You feel that restriction there in your lower cervical spine?
Yeah.
It's not awful, but
No. It's been a lot worse, but you're taking care of it. Yeah.
yeah. Nice deep breath in and go all the way out. All right, let's check the shoulder again. So first, arms like this, and down a little bit. Yep. And I'm gonna press down, resist me. 1, 2, 3, resist. Any pain?
No, weaker, but not pain.
Yeah, we'll do that again. 1, 2, 3, resist. Yeah, that was weak. Okay.
Yeah.
Now, and that may have, when I pulled your arm out, it may have pulled it out a little bit forward again.
Right.
So my guess is this, the first time it went back in,
Yeah.
pulled back out again. So,
Yeah, so I think you're right because the instability of it.
yep.
Yeah.
So we're gonna test this. 1, 2, 3, resist.
Oh, sorry, I thought you were going the other way.
Okay. 1, 2, 3, resist. Good. Any pain? 1, 2, 3, resist. Stand up. Just visually check. Definitely still stronger. And it is slightly higher. If you zoom in here, it did come out a little bit on that cross arm adjustment. So we're going to adjust it again. Lay on your back. It won't be sore. It really won't be. Slide up just about 2-3 inches up to my hand. Right there is good. Okay, stand right there. There we go. Now it's balanced. Lay on your back. Just gonna muscle test the joint. And 1, 2, 3, resist. Stronger. How'd that feel?
Yeah.
Any pain?
No.
Okay, now arms out. This we haven't adjusted yet. 1, 2, 3, resist. How's that?
Not so bad. I
Okay.
mean, still weaker than this one, but yeah.
Okay,
not
so we're gonna
bad.
do a light adjustment for that.
Okay.
Normally I would use my arms to adjust that, my hands, but we're gonna do something a little different here with an activator. This is an activator.
Oh,
Have
yeah.
you seen one of these?
Oh, yeah. I've been jealous of this.
Yeah, we use the speed instead of force.
Uh-huh.
They make all different kinds of activators. But okay, arms out. Down a little bit. Yep. And 1, 2, 3, resist. Much stronger.
Yeah,
How's that
definitely.
feel? Any pain?
Yeah.
Okay,
Yeah.
you're all set?
So continuing to kind of do this.
I wouldn't do that.
Okay.
I wouldn't do that.
That seems it. Okay. So don't do the thing that gives it relief because it's not helping the problem.
It may not be.
Okay.
Yeah, it may
Got
be
it.
causing more
Got
of a
it.
problem.
Okay.
And then we want to make sure you can check your clavicle every,
In
every
there.
day
Uh-huh.
maybe.
Mm-hmm.
But some things that can cause that clavicle to pop up and out is sleeping on your shoulder. Or an old shoulder
So I
injury.
sleep all night,
Yeah, no
Pillow under
good.
here. Yeah.
No good.
Okay.
I know they sell online some side sleeping pillows. They're probably
Yeah.
pretty awkward.
I
I
have
don't
a
know how
pillow
you
under
put
my
it.
leg and a pillow under my arm, and I have
You
to
do.
kind of get in that right position. Yeah. So definitely. Okay. Thank you, doctor.
All right, you're
All
welcome.
right.
Thanks for tuning in, guys.
Okay.